is Dr. Noah Chandler-Yanko, and today I will be holding a group therapy session for individuals suffering from OCD. Today you will get to meet the patients, as well as learn more about their specific OCD disorder. Now, you may already have a couple of questions, such as, what is OCD, or how does group therapy work? First off, OCD, or obsessive compulsive disorder, is characterized by unreasonable thoughts and fears that lead you to do repetitive behaviors. It's also possible to have only obsessions or only compulsions and still have OCD. With OCD, you may or may not realize that your obsessions aren't reasonable, and you may try to ignore or stop them. But that only increases your distress and anxiety. Ultimately, you feel driven to perform compulsive acts in an effort to ease your stressful feelings. OCD often centers around themes such as a fear of getting contaminated by germs, as you will see in one of our patients today. Now let's talk about the symptoms of OCD. OCD symptoms usually include both obsessions and compulsions, but it's also possible to only have obsession symptoms or compulsive symptoms. About 1/3 of people with OCD also have a disorder that includes sudden, brief, intermittent movements or sounds, also known as tics. Obsessions often have themes to them, such as fear of contamination or dirt, having things orderly and symmetrical, or aggressive or horrific thoughts about harming yourself or others. OCD compulsions are repetitive behaviors that you feel driven to perform. These repetitive behaviors are meant to prevent or reduce anxiety related to your obsessions or prevent something bad from happening. However, engaging in these compulsions bring no pleasure and may offer only a temporary relief from anxiety. You may also make up rules or rituals to follow that help control your anxiety when you're having obsessive thoughts. As with obsessions, compulsions typically have themes such as washing and cleaning, counting, checking, demanding reassurances, following a strict routine, and orderliness. Lastly, let's talk about the side effects associated with OCD. Obsessive compulsive disorder can quickly become all-consuming and even physically disabling. A person may be able to do little else but spend time on the obsessions and compulsions. OCD sufferers often have a very poor quality of life because the condition rules most of their day, and the signs and symptoms are so troubling to friends and family. Very quickly, I want to move on and talk about group therapy. Group therapy is a type of psychotherapy that involves one or more therapists working with several people at the same time. This type of therapy is widely available at a variety of locations, including private therapeutic practices, hospitals, mental health clinics, and community centers. Group therapy is sometimes used alone, but is also commonly integrated into a comprehensive treatment plan that also includes individual therapy and medication. Now it's time to meet our patients.
My name's Tyler Edens. I've been suffering from counting OCD for about 5 years now. I have to make sure all my things in my room are color coordinated and symmetrical, and if I don't, I'm afraid something bad will happen. Oh my gosh.
Hello, my name is Bray Garner. I suffer from washing OCD and I've suffered for 3 years. I shower up to 4 hours a day and wash my hands over 50 times a day because I think I can never get clean enough.
Hi, my name's Evan Garut, and I've been suffering from hoarding OCD for the past 6 years. I have sought Dr. Chenlyanko's help with my disorder, and hopefully things will turn out good.
Good afternoon. Today is April 6th. It is 1 p.m. and welcome to our group therapy session. I am Dr. Chenlyanko. I am a psychiatrist and I specialize in group therapy. I brought you all here today so that you could see that you are not alone in your OCD disorders and there are other people just like you. Let's begin today's therapy session by going around the table and introducing ourselves.
Hi, I'm Tyler.
Hi, Tyler.
I suffer from counting OCD. I've been suffering for about 5 years now.
Good to know.
Hi, I'm Evan.
Hi,
Evan.
I've been suffering from hoarding OCD for the past 6 years, and
Hi, I'm Brett.
Hi, Brett.
I've been suffering from washing OCD for about 3 years and I shower and wash my hands a lot.
So tell me, why do you feel that everything needs to be organized?
I feel like there's something bad if I don't have everything organized, like something bad will happen and it'll be all my fault.
Can you elaborate on what bad things could happen? Earthquakes?
Losing my dog. Dying.
Evan, explain to me why you hoard.
Well, a few years ago, when I was like a kid, my parents died in a car accident, and anything that reminds me of them or my past childhood, I just keep, and I don't want to throw it away.
Interesting.
I don't want to throw them away.
Brett, tell me, why do you feel the need to always be washing your hands or taking a shower?
When I was a kid, I got staph infection and it was pretty bad, so now I have to always shower and wash my hands because I'm afraid the germs will harm me again.
Now, Tyler, have you noticed anything peculiar about the room we're sitting in currently?
No.
Well, before you sat down and I arranged everything so that it was out of order, I placed a chair facing the opposite direction. I placed placemats all over the table. I have another patient wearing headphones on his head incorrectly, and our other patient facing the opposite direction. So as you can see, nothing bad has happened. Earthquake hasn't happened. You haven't lost your dog. You're not dead. So as you can see, there's nothing to be worried about.
I guess you're right.
Evan, we've just recently looked at your file, and we've noticed that your insurance will not cover these group therapy sessions. Therefore, we will be unable to offer you any help. We're sorry.
Cool, whatever. My parents just have placemats, so mine.
After hearing everyone else's stories, I realized that I'm not really alone in my disorder.
I'm glad you've come to realize that, Evan. Now I want you to shake everyone's hand. Have you noticed that now that after you shaked our hands, you weren't inclined to use any Germ-X or Clorox wipes to sanitize yourself?
Yeah, I guess so.
After group therapy, I've learned that others suffer too, and through that, I'm no longer suffering from counting OCD.
The people I met at group therapy helped me learn about ways to cope with my OCD. I no longer suffer from my washing OCD, and now I only wash my hands before meals.
After group therapy, I have had constant thoughts of suicide. It did not help me at all.